Guys, my name is Dr. Assistant, and today we're going to talk about the Usmle changing its grading system from a scored system or a numeric system to a pass or fail. I have an evaluation form here. It's not the real evaluation form. It's just some information that I picked off of a Facebook page. It's a forum for those sitting step 1 and those applying to residencies. Now, this person claims to be attending or someone that sits on the board for those applying to residency programs. His specialty of choice was internal medicine. No. These are the 7 parameters that you as an international medical graduate will be evaluated on. Your scores, step 1. The higher the better. So step 1 score greater than 245, a step 2 score greater than 253 is considered competitive. The next one is medical knowledge. Do you have a MPH, a PhD? In my case, a second undergraduate pertinent to the specialty that I'm choosing. They want to know. And then they also want to know if you have good clinical knowledge, so they may ask you a question in the interview. Now, this is not unique to the United States. In the United Kingdom, when I did an interview for Y Valley, they actually asked me ATLS protocol and care of the critically ill surgical patient in the interview. This is normal. 3, if you're a medical student of the United States or a medical graduate from an international medical school. Now you get more money, you get more points for being a graduate of the United States, obviously, since it's the United States that you're applying to. But I say that to say this, it may sound unfair, but it's not. Let's just be real. United States is one of the only places worldwide that gives you an opportunity to actually train in a program more readily than any other country on the planet, any other first world country on the planet. So that's a plus. So give them credit where credit is due. They may want to give, I think any country want to give their graduates first choice. Yeah, that goes without being said. Next thing is the interview, which carries the most points, 60 points apparently. Now, you're not supposed to go into the interview and say, I am the bomb and I will make this residency much better because I am the bomb. No. They're not looking for arrogance. They're looking for people who actually fit properly into the program, easy to work with, good team players, good morale, good work ethics, things like that. I don't know how they evaluate that, but just be humble, but still assertive. Next thing they're looking for is letters of recommendation. Hospital-based physicians in the United States, they're not looking for physicians that are based outside the United States. Those letters of recommendation mean nothing. They want physicians in the United States, preferably in a hospital-based setting or affiliated to a hospital. The sixth thing that they're looking for is clinical research. The more papers, the better. The more papers pertinent to your specialty, the better. And the last thing, they want to know your support system in whichever state you choose. For instance, if you want to have your kids there, family there, I don't know how many residencies ask the 7th question or 7th point, but they want to know your support system is good. All right. So here's my take on the fact that the USMLE is changing to pass or fail. Now, I just told you that step 1 score greater than 245 is considered competitive. Bear in mind that these changes start in 2021. January 2021, apparently. Now, if they change to a pass-fail, just bear in mind that most examinations now for the first world countries are pass-fail. Now, this United Kingdom, I think PLAB is pass-fail, and I also know for a fact MRCS is pass-fail. They give you your value as in the score, your particular score, but it's still pass-fail. So my thing is this, if they do it like how the MRCS does, where they give you your grade, is it that the universities get the grade, but just still take it as pass or fail? Because if that's the case, your score still counts. If it's a situation where you just get a pass or fail like step 2 CS, well, then that's different. But if it's a situation where you actually get a pass or fail, then they give you your scores and your scores still count. So I don't know which one they're going to choose. As I mentioned, MRCS still is pass or fail. When you go on the website to check your pass or fail, they actually show you pass or fail on the website. When they send you the letter stating your score, which I showed up further down in some of my older videos, I showed what the MRCS letter looks like. They actually give you your score, so you know your score. So if it's really pass or fail and don't give you any idea of your score, then your step 2 CK score has to be on point. Now here's the thing. Does it put you as a disadvantage as an IMG? I'm not certain. I actually think then it doesn't just target you, because then it means that all residents or all medical graduates all around the world, they will be evaluated based on their step 2 CK. So it's still just as competitive. Now my thing is this. Is it that the research that you do and your postgraduate qualifications, are they more, do they carry a greater weight then? Because if you have a PhD from the United States compared to a person who has an MD from outside the United States, and you get the PhD but you're an IMG, I'm pretty certain your application form looks more competitive. Yes. And they then put more weight on your PhD. Suppose your PhD is in, like, I don't know, education. Is it that you are more valuable to the team because you have a PhD in education and it's from the United States? I'm not really too certain what was the rationale behind the shift, but I think then they are trying to say now that the step 2 CK should be more valuable. One, clinical knowledge. 2 is very invaluable too. So I'm wondering if it's a situation where they did a survey of medical graduates and they determined that medical knowledge was lacking, or they thought that persons didn't put as much emphasis or study time into step 2 CK, and they're finding that they're trying to improve those that actually get through improve the quality of the graduate that goes into the residency programs. I'm not certain the rationale. All I know is that step 2 CK is the information that you use on a day-to-day basis as a physician, especially in general practice. Step 1, I've never seen one patient with maple syrup urine syndrome, ever. Never seen a patient with any disease such as Leishmanian, Niemann-Pick disease, none of those, never once. But in step 2 CK, you see a lot of things that you would use. You use a lot of the information from the books. You can actually study for your clinicals for your medical school from step 2 CK. You would just have to adjust some of the values. For instance, in obstetrics and gynecology, there will be some parameters that would be changed. Like, for instance, the viability of a fetus. Some countries have 28 weeks, some countries have 24 weeks. So, things like that there will change, but for the most part, the information, it doesn't spoil. So, yeah, step 2 CK now will become the main bit of data that they have, that they will use to determine if you're worthy of going into their residency. Now, the good thing is that persons usually score higher in step 2 CK. But the bad thing is that if you have a bad day for step 2 CK, there's no coming back from it. There's no, okay, I did bad in step 1, let me see if I get a higher step 2 CK. No. Because I've even seen students get, in step 1, they get 211, and then step 2 CK, they got like 265. That's a huge jump. And they actually matched because their step 2 CK was really good. They might have had a bad day in step 1. But now you have one day, like Eminem says, you have, or not Eminem, that guy that sings, all I need is one mic, and you literally have one day and you have one chance to score really, really high. So is it bad? It might be a little bit bad for those who want to, give themselves the best chance possible. You still have time. January to 2020 is still some time away. I'm doing my exam hopefully in January or in December of this year. I'm studying same way. Last night I did about 28 questions, 27 questions, and it took me forever. Let me just say that straight off the bat. It takes me forever to get through these questions, and I have to start while I'm at work when I have downtime, because I don't know how people do 2 and 3 blocks a night. I don't do that. The good thing is that when I make my notes, I just have to browse those notes when I'm finished, which is what people have been doing. So, yeah. I hope everyone is good. Hope everyone is safe. I hope my tips help, and I hope my opinion makes you or puts you at ease. They're not trying to push us out. They're not. As in, a lot of the times when you read in the forum, people are saying, "Oh, it's an attempt to keep IMGs out of the United States." No, it's not, because if that was the case, they would change the rules for only IMGs. But that's not what they're doing. They've changed the rules for everybody. So it just means we have to study hard and put more weight on the step 2 CK and smash the exam. So guys, if you like this video, please subscribe.